is no one single cause of breast cancer. However, there is what we call risk factors.
All right.
So risk factors means that when you have that factor, the chances of you getting breast cancer is quite high. So for the risk factors, we classify them as modifiable risk factors and then non-modifiable risk factors. So the non-modifiable ones are the ones we really can't do anything about. So example is being female. Breast cancer is common in females. When you have female, there's nothing really you can do about it. Another risk factor is increasing age. That's also something you can't do anything about. Another risk factor is early menarche, when a lady starts, the age at which a lady starts her menstruation. So if a lady should start menstruating, say at the age of 12, that also poses as a risk factor. These are things we can't do anything about. They are natural. It's genetics. It's how you came about. Also, some have a family history of breast cancer. That's also a non-modifiable risk factors. And then there are some genetic abnormalities that have been noted to lead to breast cancer. So some people have some of those genes. So that's also a non-modifiable risk factor. Then we have the modifiable risk factors. That's where we come in, such as obesity and being overweight. So part of the process of breast cancer is estrogen feeding the cancerous cells to multiply. And for people who are obese or overweight, they have a lot of peripheral fat, which can be converted to estrogen. So having excess fat can lead to the fat being converted to more estrogen, which will feed these cancerous cells. The other thing too is alcohol and then cigarette smoking. These are also things that can increase your risk factor for breast cancer. And then sedentary lifestyle, it's also linked with being obese and overweight and not watching your diet. So the more sedentary you are, the likely you are to be obese or be overweight, which also leads to the increasing your risk factor for developing the breast cancer.